Welcome to The Explainer. Today, we are diving deep into something that affects millions of people, a lot of the time in total silence: pre-diabetes. But hey, we're not here to scare you, not at all. We're here to uncover the surprising truth about what's really going on and, most importantly, how you can fight back. So let's just start with a number that should make you pause. According to Sharp Healthcare, 1 out of every 3 adults in the US has pre-diabetes. Just think about that for a second. In a room with 3 people, statistically, 1 of them is on that path. It's a huge number. But here's where it gets really crazy. Of all those millions of people, a whopping 9 out of 10 have no idea. They don't even know it. They're just going about their day completely unaware that their health is at this really critical tipping point. So this begs a massive question, and it's the one we're going to tackle today. What are we all missing? How is this epidemic hiding in plain sight? And what's the real key to turning this whole thing around? Okay, before we start busting some major myths, let's get on the same page about what we're actually up against. What even is prediabetes? Well, the definition is actually pretty simple. Prediabetes just means your blood sugar levels are elevated. They're higher than they should be, but not quite in the type 2 diabetes range yet. You got to think of it as a huge warning sign from your body. And this is the most important part. It's a reversible one. All right, let's get right into it and bust the biggest myth of them all. When you hear high blood sugar, your brain immediately jumps to sugar, right? It seems obvious. But what if I told you the main culprit is often something else entirely? This quote from Professor Naveed Sattar absolutely nails it. He says, his patients swear up and down, "But doc, I don't eat that much sugar." He explains that the real issue is often excess weight, which causes fat to build up in places it shouldn't be, like your liver. So you see, it's not just about sugar. It's about how your entire system is working. So why is that extra fat such a big deal? Well, it all comes down to the real root of the problem: insulin resistance. This is the biological mechanism that's actually happening inside your body when it starts having trouble with blood sugar. Let's use a quick analogy to make this super clear. Just imagine insulin is a key. Its only job is to unlock the door to your cells so sugar, which is glucose, can get inside and give you energy. Pretty simple, right? Key, door, energy. Now, normally, this system works perfectly. The key fits, the door opens, sugar goes in. But what happens when the lock on that door gets all gummed up? The key can't turn, the door stays shut, and all that sugar just gets stuck outside in your bloodstream. And this is the stuff that's gumming up the lock. Research from experts like Dr. Cyrus Kambata shows that it's an excess of fat in our diet, especially saturated fat. This fat literally gets inside our muscle and liver cells, and it physically blocks insulin from doing its job. That right there is insulin resistance. Now, this is super important. Not all fats are the bad guys here. As you can see, there's a definite ranking. Trans fats, they're the absolute worst. Dr. Kambata even calls them dietary napalm. Then you have saturated fats from things like butter and red meat, which are the next biggest problem. The fats you actually want to focus on are the unsaturated ones from foods like avocados, nuts, and olive oil. This brings us perfectly to our next myth, and this one could be sitting in your pantry right this second: the so-called healthy breakfast. Dr. Tony Hampton calls some of these popular cereals candy that floats. And, well, you can see why. He puts cereals like these in what he calls Tier 5 panic button. Why? Because they're basically just sugar and refined carbs that send your insulin on an absolute roller coaster, which is the last thing your body needs. But honestly, it's the sneaky ones that can trip us up the most. This slide calls it the breakfast betrayal. On the left are cereals that so many of us grew up thinking were the healthy choice, like Raisin Bran or granola, but they are packed with refined grains and hidden sugars that still make your insulin spike. The options on the right are much safer swaps, using protein and fiber to keep your blood sugar nice and stable. And Dr. Hampton just sums it up perfectly here. You know, a patient might say, "But Raisin Bran is good for my digestion." And he points out the trade-off. Sure, you might be getting some fiber, but if that same breakfast is hammering your insulin day after day, you're losing the bigger metabolic war. Which brings us to our final and maybe the most disempowering myth of all. This idea that getting a prediabetes diagnosis is basically a life sentence, a one-way ticket to type 2 diabetes. This slide lays it all out. The myth is that it's a dead end, that it's unavoidable. But the reality, which is confirmed by so much research, is that you can delay it, you can prevent it, and in many cases, you can fully reverse it. It is not a life sentence. Just how reversible is it? Well, get this. According to Dr. Kambata, for people who switch to a low-fat, whole-food, plant-based diet, the potential reversal rate for prediabetes is nearly 100%. 100%. And it doesn't stop there. With that same approach, the potential reversal rate for full-blown type 2 diabetes is still a staggering 80 to 85%. This isn't about just managing a disease for the rest of your life. It's about actually reversing the cause. The message here is just one of incredible hope. So, I bet you're thinking, okay, this is amazing, but how do I actually do it? Let's turn all of this knowledge into a super simple 3-step action plan. Here we go. Step 1, manage your fats. Focus on getting those healthy, unsaturated fats in and really cut back on the saturated and trans fat. This is what helps ungum those locks on your cells. Step 2, rethink breakfast. Ditch those sugary cereals for something with protein and fiber. And finally, step 3, a goal that major studies back up, aim to lose just 5 to 7% of your body weight. You know, for a 200-pound person, that's only 10 to 14 pounds. It's so achievable, and it can be enough to reverse prediabetes completely. And that brings us to our final thought, and it's really a question for you. Now that you have this information, what's the first simple swap you're going to make? Maybe it's changing your cereal or the kind of oil you cook with. Whatever it is, just remember, the power to turn this around is absolutely in your hands.